Hi, this is Dr. Barron with High Point Spine and Joint Center, your Western Nebraska chiropractor. I just wanted to do a quick video today to talk a little bit about arthritis. And really, there's three things that I want to talk about. What is arthritis? What are some of the conventional treatments? And how can chiropractic help? Okay, arthritis is literally inflammation in a joint. Arthro meaning joint, itis meaning inflammation. And so it literally translates into inflammation of a joint. Okay, there's multiple different forms of arthritis. There's things like ankylosing spondylitis, rheumatoid arthritis, even gout is a form of an arthritis. But the most common form of arthritis is osteoarthritis, which is also known as OA. Osteoarthritis is prevalent. It's in about 1 out of every 3 individuals over the age of 65 have osteoarthritis, and it's characterized by decreased motion in a joint, decreased mobility, increased pain, increased stiffness, and it's because of that inflammatory process that happens. A joint, most joints have 2 bones that connect. They're surrounded by a capsule that's filled with fluid that creates kind of a slick surface for those joints to move on. However, with arthritis, what happens is you get a decrease in the space between the joint, and then that causes some wear and tear, which creates inflammation. That inflammation causes some osteoprolific events to happen to create bone spurs and things like that within a joint. And the body's good, it's trying to create more bone in order to stabilize an unstable joint, and that's where you get arthritis from. Some of the conventional treatments for arthritis are non-steroidal anti-inflammatories, things like ibuprofen, Advil, Aleve, Motrin. Those are all non-steroidal anti-inflammatories. They help decrease inflammation. Over time, they can be kind of hard on the system, so they have their drawbacks if they're taken for long periods of time. There's also steroids, which are and also a powerful anti-inflammatory, but again, steroids also have their drawbacks. They can only be given ever so often. The injections are a good way that they do that, and in certain situations they do very well at helping us manage arthritis, but they're not a complete cure, they're not a complete fix, but they can help us manage in certain situations. So how can chiropractic help? How chiropractic helps is really to try and restore motion. And so by seeing a chiropractor when you have arthritis, he's looking at all the spinal joints, he's looking at all of the extremities, your shoulders, your hips, your knees, your pelvis, looking at all these joints from a biomechanical perspective in order to improve motion. By improving motion, then we get less irritation in a joint. And so it can help us to decrease a little bit of the inflammation. It can help us to decrease the pain. It can help us to increase its range of motion. And all of those things help with arthritis and preventing arthritis. But again, prevention is the key. We're working with the limitations of matter. So once a joint is so arthritic that it has a lot of bony plurific changes in it, and lots of bone spurs and things like that, how much that a chiropractor can reverse that is minimal. So prevention is the key in trying to catch it early. Also, though, even once it's bad, we can try and slow the progression a little bit. So prevention's the key, getting it early, trying to maintain your motion and improve the mechanics is really the key to trying to help with osteoarthritis. So if you have any questions, let us know. We'd be happy to help you at any time. Thanks.